The ability to telepathically communicate with others and enhance your mental function is a promise that is definitely one of Elon Musk's most attractive. Many were left with their jaws open when it was first announced, and there are still many people who doubt it. And now it seems more mouths will be agape as Elon Musk just revealed the Neuralink update for 2022. Let's check it out. Neurotechnology has been available for about half a century, but only in the last 20 years has it matured. The introduction of brain imaging transformed the discipline, allowing researchers to observe the brain's processes in real time during trials. Neurotechnology has had a considerable influence on society, despite the fact that many people are unaware of its prevalence. From antidepressants, sleep aids, ADHD medications, and antineurotics to cancer screening and stroke rehabilitation, neurotechnology impacts practically everyone in the industrialized world, either directly or indirectly. But what is neurotechnology? Any method or equipment in which electronics interface with the nervous system to monitor or alter brain activity is referred to as neurotechnology. It may also be used to describe the employment of technical techniques to develop items that have an impact on brain and mental functioning. Using brain activity readings to control external devices such as neuroprosthetics, modifying neural activity via neuromodulation to heal or normalize function damaged by neurological illnesses, or boosting cognitive capacities are all common design aims for neurotechnologies. Modern technology can now see practically every element of the brain, as well as manipulate a portion of its function. It can assist with depression, overactivity, sleep deprivation, and a variety of other issues. It can assist stroke victims restore their motor coordination, lessen epileptic episodes, improve patients with degenerative motor illnesses such as Parkinson's disease, Huntington's disease, or ALS, and even eliminate phantom pain perception. Many novel upgrades and rehabilitation procedures for people with neurological issues are expected as a result of advancements in the industry. Neurotechnologies, like other disruptive inventions, have the potential for substantial social and legal ramifications. Therefore, their development and adoption into society create a slew of ethical concerns. Identity preservation, agency, cognitive liberty, and privacy are all major considerations. While experts believe that the ethical use of neurotechnology would enrich these essential aspects of the human experience, they also emphasize the significance of proactively implementing specialized regulatory frameworks and other procedures to protect against unethical or unauthorized usage. Elon Musk has nonetheless been very interested in making a move into neurotechnology for a long time. He, along with Max Hodak, Ben Rappaport, and Dojin Xiao, among others, established Neuralink in 2016. A number of professionals in fields including neurology, biochemistry, and robotics make up the founders' circle at large. In April 2017, Neuralink revealed that its short-term objective was to develop devices to cure significant brain illnesses, with the long-term goal of human improvement, sometimes known as transhumanism. Musk stated his interest in the notion arose in part from the science fiction concept of neural lace in the fictitious setting of Ian M. Banks' The Culture series of 10 novels. Musk described the neural lace as a digital layer above the brain that would ideally be implanted by a vein or artery rather than lengthy surgery. The long-term objective, according to Musk, is to develop symbiosis with artificial intelligence, which he sees as an existential danger to mankind if left uncontrolled. According to Gizmodo, Neuralink remains very covert about its work, despite public documents revealing that it attempted to build an animal testing facility in San Francisco. It then began conducting research at the University of California, Davis. The Neuralink team presented the technology of the first prototype they were working on at a live presentation at the California Academy of Sciences in 2019. It's a device that includes ultra-thin probes put into the brain, a neurosurgical robot that performs the procedures, and a high-density electronic system that can interpret information from neurons. It's based on technologies created at the University of California, San Francisco, or UCSF, and the University of California, Berkeley, or UC Berkeley. Neuralink also claims to have built a robot that can swiftly inject a large number of flexible probes into the brain, perhaps avoiding the tissue damage and lifespan issues that come with bigger, more rigid probes. This robot contains an insertion head with a 40-meter diameter tungsten rhenium needle that is meant to attach to the insertion loops, transfer and insert individual probes, and penetrate the meninges and brain tissue. to 6 wires or 192 electrodes can be inserted each minute by the robot. In order to truly turn the human being into an overpowered supercomputer in its own right, they've created a 1,536-channel recording device using an application-specific integrated circuit, or ASIC. This system comprises 256 independently programmable amplifiers, or analog pixels, on-chip analog-to-digital converters, or ADCs, and a peripheral circuit control to serialize the digitized data acquired. Its goal is to transform information from neurons into a binary code that can be understood in order to gain a better knowledge of brain function and the capacity to activate these neurons again. Electrodes are still too large to record the firing of individual neurons with current technology, so they can only record the firing of a group of neurons. Neuralink representatives believe this issue can be solved algorithmically, but it is computationally expensive and does not produce exact results. According to Musk, Neuralink received an FDA breakthrough device classification in July 2020, allowing for limited human testing under FDA medical device criteria. In April 2021, Neuralink showed a monkey utilizing the Neuralink implant to play the game Pong. While comparable technology has existed since 2002, when a study group first exhibited a monkey manipulating a computer cursor using brain impulses, experts praised the advancements in making the implant wireless and expanding the number of implanted electrodes. Thus, we can be confident that Neuralink is making progress, but the lack of regular updates and info coming out has been a silence that's rather deafening. Elon Musk recently spoke at the Wall Street Journal's CEO Council Summit about what the future holds for mind-bending technology. We have Neuralink working well in monkeys. We're also doing a lot of testing and confirming that it's very safe and reliable, and that the Neuralink device can be removed safely, Musk said. Elon Musk considers the Neuralink implant to be a profound innovation. He added, "We hope to have this in our first humans, which will be people that have severe spinal cord injuries like tetraplegics, quadriplegics, next year, pending FDA approval." In order to increase confidence, he also said that Neuralink's standards for implanting the device are substantially higher than what the FDA requires. The new 2022 timeline was reiterated in a tweet. "Progress will accelerate when we have devices in humans. Hard to have nuanced conversations with monkeys next year," he said. Musk has wanted to begin human testing of Neuralink around 2021. This did not happen in typical Elon Musk fashion, and the time frame has now been pushed back. While Musk appears to be bullish about the technology, its value, and the pending FDA approval, he has a track record of offering unrealistic timetables. Neuralink said it will use the $205 million it raised in July 2021 to further develop its technology, which would allow quadriplegics to operate digital gadgets with their minds. However, Neuralink isn't the only business working on brain-computer interface technology. The Food and Drug Administration gave Synchron, a 20-person biotech business, permission to begin human testing in July. As Neuralink is moving to test such a drastic technology in humans, scientists have raised concerns. Musk described one of their early gadgets as a Fitbit in your skull during a live presentation in August 2020, claiming that it might soon treat paralysis, deafness, blindness, and other afflictions. These statements were slammed by a slew of neuroscientists and journals. They were labeled as extremely speculative and neuroscience drama by MIT Technology Review. Mary Lou Jepson, the founder of Open Water, a business that also works in the field of brain-computer interfaces, is concerned about probe rejection reactions. Professor Andrew Jackson of Newcastle University's Department of Neural Interfaces said that while he didn't think there was anything revolutionary in Neuralink's pig implant presentation, but that the wireless features were nice. Lastly, Thiago Arzua of the Medical College of Wisconsin argued Neuralink has showed little more than a flashy new design for a BMW with more electrodes. YouTube is now recommending some of our other videos to watch. Before you head on to them, though, be sure to leave your thoughts about Neuralink and its future, and we'll see you in the next video.